And this is the much better way to do full contour bridges, much more superior than using silhouette or any sort of other bridge connector. So here we just have a 3-unit bridge, and it's a full contour zirconia, and if you select all three, you'll see under bridge the type should come in default as none. If it is silhouette, you can drag it down to none, and you can actually change this within the case if you have it set incorrectly, and I'll show you that really quick. At the top left in design, you'll notice you can select the tooth or the bridge connector itself. So I'm just going to select one of the bridge connectors, the rearmost, and then down at the bottom left it'll actually give you connector settings. So instead of having like silhouette or elliptical 9mm, you just select none. And this is a good way, to change it. Say if you're doing anatomical, it comes in default as silhouette. You can come back and fix it. So the way the bridge connectors work with full contour with none as a bridge connector is it's done through intersection, so through having them collide and crossing through each other. And so right here I'm just kind of fixing my contact, and then I'm just using the global or the transform tool and pulling it out. Now you see here I have a nice intersection on the two restorations, the pontic and the prep, and you can do a little tweaking. And don't worry about making the connection too large in this stage. In the next step, when it finalizes, you'll see it's much easier to make it a thicker, broader contact and a thicker connection. So I'm just kind of moving on, and you see up here, in finalize is actually when it takes the 3 restorations and it fuses them all together. So it's like a fused single piece. And now let's take our wax knife tool, and I like a strong on the strength and a small diameter, and you just go around the bridge connector, and since they are fused together, it'll just pop out with that smooth tool. And if you have a hard time getting to the interiors or the interproximals, you can just hide the operative arch. And so this one, say I want to bring it down, you can take the wax knife add tool and you can kind of bump it down. But rarely, you need to do this. Rarely you need to make the connection that strong, especially with a little smoothing. And then this first connector I'm doing is a little overkill, I think. This next one, which has this even smaller intersection, I'm just going to really lightly go around the edge, the intersection, and just slightly touch it up. And don't worry about if it's too tight. The mill will know that. Actually, hang on, undo that. I didn't like that. The mill will know it won't be able to get into that interior surface, and it will not attempt to go in there. So here we have our final product, kind of one bulky and then one kind of a thinner standard type. I'm actually going to take my cross section tool and drag it across the bridge connection, and this is a great way to tell right here the square area of the connection. So this is what you would typically see with the normal bridge connection tool, is that center guide where it's telling you the strength of it. This is a way to do that with this system. You do a 2D cut tool, and then you click on the area measurement tool. And now, so next I'm going to go over bridge connectors on anatomical copings with facial cutbacks, and this also works with interproximal struts. So this is just me setting up the case. So it's an anatomical coping and an anatomical pontic. So that's good, and let's select all three. And you notice it defaults with the silhouette. I'm going to bring this down and just do none. And again, if you go through this with silhouette, it's not the end of the world. You can change the individual bridge connectors during design. And so, with anatomical, you do a full contour design, and you do it the same exact way as you would a full contour bridge connection. The only difference being, it is anatomical, so you have to do facial cutbacks, on all 3 units. The pontic can be a little tricky. You want to make sure lingual band is selected when you do the pontic, and get these control points around. And you kind of slowly bring it around, And the trickiest thing with Pontics is if you go too far, it switches sides on you, and I'll show you that in 1 second. I'm going to skip forward here because you get the idea. You kind of pull it over, making sure our facial is the cutback. And here we have it pretty close, but now I want to get a little bit closer, so I'm going to move these points, around to make it a little bit more of a facial window. And if I hit apply, or actually this one was a little bugged out, so I'm going to actually have to sculpt to apply. Notice now it's switched sides, so I'm going to just tweak it back, just pull it back slightly. I'm going to go back to hitting apply or sculpt, and that is more ideal. It's not perfect, but Pontics are a little buggy with anatomical features, and if you've done them before, you know exactly what I'm talking about. And so the facial cutback is just like what you'd normally do. And if you have any questions, there's actually a video on how to do facial cutbacks. So go watch that one if you have any questions on how to get that. So I'm going to kind of run through this quickly. So I just hit apply on the facial cutback. I got it to where I liked, and so now we have our facial. And so if it's an interproximal strut, it would be along the same lines. You'd have the interproximals as full contour. So you'd be able to bridge them in a very similar way. So I'm just kind of tweaking this. So I've got it where I want, and let me just skip forward. So now we have all of our facial cutbacks on all 3 units. And now once you're happy, I'm just going to hit OK. So right there, I'm just checking, make sure my bridge connector is at none. Just kind of go through it, hit OK, OK. And just like before on the full contour bridge connector, you'll see when you go forward into the finalize step right before saving, it fuses the 3 pieces together, and you notice you will not be able to change past the cutback. So to change that, you go down in the bottom left, allow sculpting under lingual bands. And this is the big thing with anatomical copings. Pretty much full contour bridge connector. If we allow that, then like before in the last part, you'll be able to take your smooth tool and you'll be able to bulk out that connection. Something really important, when you turn on sculpting under lingual band, not to touch around the marginal area. You can destroy the distance offset on the margin and make it too thin and not be able to be milled. And so we're kind of just tweaking it, making it nice and thick. And then once I have it where I want it, be careful around the actual cutback area with the smooth tool. You might not get your desired results. So I'm going to do the 2D cut tool one more time like before. To the surface area, 9.3, not bad. And we are good to go. If you guys have any questions about this technique, you'll find it saves you a lot of time opposed to using silhouette, and leaving a little space.